Today we will be presenting on the Oral and Written Language Scales 2nd edition, also known as the OWLS 2. Our group members are Jamie Adkin, Kathleen Costers, and Krista Robeson. So here we have our advanced organizer, just to give you a rundown of what we will be discussing for this presentation. We will be going over general information, purposes of the test, dimensions and constructs the test is purported to measure, description of items, test norms, interpretation of scores, reliability and validity, practical features, undesirable and desirable features, and our overall presentation. So our test title, as stated previously, is the Oral and Written Language Scales 2nd edition, also known as the OWLS 2. The authors are Elizabeth Carroll Wilfork and Kathleen Williams. The publisher and copyright date are Western Psychological Services from 2011. The grades and ages for this assessment are children ages 3 to 21, typically with receptive and expressive language difficulties, whose primary language is English. For the oral language scale, which we will be discussing later on in our presentation, the ages are 3 to 21. And for the written language scale, the ages are 5 to 21. So there are two test forms for this assessment. The first one is Form A. This is a primary form that's designed for use in single assessment and on the first occasion of a repeated testing protocol. Form B is designed for use on repeated testing. So the purposes of this test: the OWLS 2 offers an integrated global approach to oral and written language assessment. It's designed to identify strengths and weaknesses in receptive and expressive language and written language skills as well. It is also used to determine the existence of language delays and disabilities in children ages 3 to 21. So, to discuss some dimensions and constructs the test is purported to measure, the test has 4 scales, and the lists are as follows: listening comprehension, oral expression, reading comprehension, and written expression. So these 4 scales give you a complete, accurate, and useful picture of language skills. Each of the 4 scales also assesses 4 linguistic structures: lexical semantics, syntax, pragmatics, and superlinguistics. So although these 4 scales can be used separately during the test, together they will give you a comprehensive score profile that pinpoints language delays, identifies strengths and weaknesses in all areas, and guides intervention. So to give you a description of each of the scales that were just mentioned, the first scale is listening comprehension. It measures receptive language. It involves listening to and comprehending spoken language. The examiner reads a stimulus word aloud, and then the examinee responds, indicating one of 4 pictures that best depicts the meaning of the word. The administration time is around 10 to 20 minutes, and the ages for this section are 3 to 21 and 11 months. The next scale we will be discussing is the oral expression scale. It measures expressive language. The examinee is asked to answer questions, finish sentences, and generate sentences in response to visual and oral prompts given by the examiner. The administration time is around 10 to 30 minutes, and the ages for this section are 3 to 21 and 11 months. The next scale is reading comprehension. It measures written language reception. The format is the items and responses are presented in text and typically require the examinee to read a prompt and then choose one of 4 response options. The administration time is 10 to 30 minutes, and the ages for this section are 5 to 21 and 11 months. The last scale is written expression. It measures written language expression. The items are presented verbally and visually by the examiner. Some are in the text and some are presented pictorially. And then the responses are written by the examinee. The administration time is around 15 to 30 minutes, and the age range is 5 years to 21 and 11 months. So here we have our test norms. The sample is based on 2,123 individuals from 31 states across the U.S. The age range is 3 to 21 and 11 months. It is an age stratified sample, and it is also representative of the U.S. population, indicating ethnicity, gender, socioeconomic status, region, age, and grade. So here we are going to discuss the interpretation of scores. So when we evaluate our scale scores, we then convert those raw scores into standard scores. This conversion into standard scores allows for comparison of results to typically developing individuals. There is a mean of 100 and a standard deviation of 15. The test age equivalents are recommended for identifying individuals with a learning disability. The grade age equivalents are recommended for planning curriculum. The scores also give percentile ranks, and it also gives descriptive ranges. So we have exceptional, above average, average, below average, and deficient. So from a combination of scales, you can interpret composite scores. So here we have a list of the type of composite scores you can compile. So for instance, our first example is an oral language composite. This score is obtained from combining the scores from listening comprehension and oral expression scales. And then the next example we have is the written language composite, which is a combination of reading comprehension and written expression. And then the rest are the other examples of the composite scores you can obtain. So for reliability and validity, content validity was found. So in this case, if the child's case fits the guidelines of the test, measures can be considered relevant. The scores distinguish typically developing individuals from those with speech and language disorders. Construct validity was also found. The OWLS 2 is based on integrative language theory, which describes conceptual domains of language processing. The scales are designed to provide access to these constructs through their standard scores. Predictive validity was also found. The extent to which the score on a scale or test predicts scores on some criterion measure, but the OWLS test does not have predictability measurements. For the reliability continued, for the speech and language impaired sample, they found that internal reliability coefficients were 0.95 or higher across composites, age ranges, and forms. For the clinical sample, all internal reliability coefficients were 0.93 or higher. The replication of high internal consistency reliability across both typical and atypical samples provides evidence that the OWLS 2 will yield internally consistent, stable scores in the setting where it is most likely to be used. There is also inter-rater reliability, which was estimated using an intra-class correlation coefficient, and the results were high levels of agreement between various raters using the same written instructions for scoring the oral expression and the written expression scale items. So overall, the OWLS is lacking information about the test-retest reliability and parallel forms reliability. So for our practical features, we have some administration features listed. So it is recommended that the scales should be administered individually. They are not timed, but there are rough estimates on how long they take for each scale. So it takes around 10 to 15 minutes for the listening comprehension, 10 to 30 minutes for oral expression and reading comprehension, 15 to 20 minutes for reading expression, and the scoring for each of these scales should be done by hand. It is also advised that administration occur in a quiet, well-lit room during each of the scales listed on this slide. The manual that was presented with this assessment was adequate, well-organized, informative, and norm-referenced. So here are our desirable and undesirable features. We thought this assessment was very easy to administer. It had a wide age range. The subtests can be individually or all together, and it had a well-written manual. Some undesirable features were the wide age range can also cause a decreased reliability, its lack of predictive validity, it was only available in English, and the time it takes for each of the scales. So overall, the OWLS seemed to be a good tool in the evaluation of expressive and receptive language. It is a valid and reliable measure which is easy to administer. The manual was also informative and included lots of details and various case studies for examples. This test is useful when determining a client's main strengths and weaknesses across multiple language skills. This assessment also helps to provide a good starting point that can help determine the direction for which to begin therapy. And then here we have our references.